Doctors Without Borders says that hundreds of lives are at risk in Sudan because of a continued ban on the transportation of medical supplies. The Sudanese military imposed the ban in areas in Khartoum which are under the control of the Rapid Support Forces. This is fighting between the two sides has continued for almost 7 months now. Let's get an update on the situation in Sudan. Bring in Doctors Without Borders emergency response for Sudan Head, Claire Nicolet. Claire, very good evening to you. Thank you so much for speaking to Newzroom Afrika. Let's begin with the basics. Why is it that this ban was imposed? Because the issue goes back, doesn't it, from about mid-October, so almost a month ago.
Yes, so basically we were refused several supply first, and then it was clarified by authorities that we cannot operate anymore as surgical side of the health of the care because of treating RSF soldiers. So it was clearly to stop our treatment for soldiers of RSF.
And is the condition for or from the Sudanese military that you will only be allowed to bring in medical supplies to parts of Khartoum if you stop treating injured members of the RSF?
So basically, first we were still able to send medical supplies, not surgical, but medical supplies. Even this is starting to stop. So meaning that now we cannot even send anything in the past 2 weeks. No agreement at all to send any supply. And we clarify with authorities that obviously most of our cases are not even soldiers, even though when they are wounded, we should be able to treat anywhere as soldiers, but it's even that most of our surgical cases at the moment are C-sections, so we are preventing now women, we are preventing children to have access to care. So the situation was not said that no, you have to stop, but for sure we were just refused. You cannot do surgical activities anymore in south of Khartoum.
Mm. And what sort of negotiation have you had to do as MSF with the Sudanese military, and do they look as though they're actually willing to hear you out? Because as you say, ultimately this ban is even affecting pregnant women in desperate need of cesarean sections.
Yeah, so the problem is for now we are really being not here at all. So we discuss at all levels, and no one is really from military side, even with Ministry of Health, helping us out, because we are working in Ministry of Health, hospitals up to now. We are discussing for a few weeks now, and unfortunately we cannot see any improvement. It's even the contrary. Now, not only, as I mentioned, surgical items are refused, but also medical items, and also for our staff to join the hospital there. So now we are really completely stuck, and little by little we see that this prevention of working is happening like in a very more important even way, and we cannot really discuss in a proper way to find solutions with authorities.
Is there a clear number now, Claire, of how many women in Sudan are waiting for cesarean sections? Because in your statement issued on this problem, this blockade, if you will, on the transportation of medical supplies, you said in a 2-month period you had performed about 170 C-sections. So there's clearly a huge need.
Yeah, so the number of C-section is really, cesarean section is really important every day, even in the hospitals we are operating in Khartoum. So yes, dozens of C-section per week. So it means all these patients they will not receive cesarean section. Obviously, as well, because of the intense fighting, we are receiving every kind of patients. That's the same. We are starting not to be able to even treat. So this is really starting to be a situation that has really, we are completely blocked now, and we have no solution so far.
And if these women, these pregnant women, are unable to get assistance from an MSF-supported hospital, for instance, do they have other options where they can go for the urgent medical care within Khartoum?
So at the moment, honestly, the structures are almost none. So they are almost not functional anymore. So that's why this hospital is so important, the one we are supporting, because there is really people, women coming from all around Khartoum to our facility to treat these patients and this mother. So that's why we are really worried of the situation, because we know that we are almost delivering for this whole population care for these women.
Where to next? Because the fighting in Sudan is continuing. It began in April. We're now in November. Much of the world's attention has moved on to the next crisis, as it often does, because there's a huge tragedy unfolding in the Middle East, in Gaza, and that's where the eyes of the world are now fixed. How much is that working to a degree against the needs of the Sudanese people, given that the story has somewhat fallen off the agenda, if you will?
Yeah, no, that's definitely one important point, that, of course, after 7 months, you will even forget a bit about the situation there. You don't even know if the war is still ongoing or not, how the situation is. And for sure, us being on the ground, we see how the situation is really worsening. It's really worsening because it's been months now that people don't have proper access to healthcare, proper access to food. Prices are skyrocketing. So it's really the situation we see that is really worse. And of course, there is not a lot of attention. There is not a lot of actors even. So we are one of the only ones now, Doctors Without Borders, being inside Khartoum, for instance. And we know that there are few millions still living inside Khartoum. So it's not small. And unfortunately, yes, for sure, it's quite difficult to have some attention at the moment.
Nicolet, with Doctors Without Borders, speaking to us about the unfolding health crisis in Sudan. Thank you very much for your time tonight.